The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining us today for our webinar entitled Medicaid Promoting Interoperability, Stage 3 in the Final Program Year. Today's presenter is Bruce Mackey, NCEDA Regulatory and Incentive Program Analyst. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping the phone lines on mute during today's presentation. If you have a question for Bruce, please type it into the questions box in your GoToWebinar interface. We'll take time at the end of the presentation to answer any questions you have. If for some reason we are unable to get to all of the questions, we will email you directly with an answer following the broadcast. We will be posting the presentation slides and a recording of today's webinar on our website, www.mceda.org. Also, the presentation slides are currently available for download in the handout section of your GoToWebinar interface. Today, Bruce will discuss the Medicaid Promoting Interoperability Program, briefly reviewing the 2021 participation requirement, incentive payment schedule, and objectives and measures. From there, he will review the accelerated timeline for this final program year and discuss important ramifications and vital considerations you need to take to ensure you finish out the program strong and are successful in claiming your final incentive payments. Lastly, with any time left, he will address questions posed by the attendees during the broadcast. Please note, the information you will hear in this broadcast is current as of today and is only intended to be a general summary. With that, I will turn things over to Bruce.
Thank you, Liz, and thank you, everybody, for joining me today to go through the final year, the program year 2021. It's hard to believe we're in the final year of this program. It's been running since 2011. We're 10 years into it, 11 years into it, and we are into the last few months. So I don't have a ton of information to share with you. It seems like a lengthy agenda, but there's not a ton of slides here, so why don't we dive right in? So participation requirements, we haven't seen any changes here, and just kind of have these here to note that those same requirements that you've been used to working with in subsequent years or in previous years are still all the same. You have to be one of those eligible professionals, EP types, those provider types that are listed in the green box on your screen there. You do have to still maintain that minimum 30% Medicaid patient volume. So you'll have to attest to that this year as well to get your foot in the door for your clinicians. You do have to be on certified EHR technology, of course, have to meet all of the promoting interoperability objectives and the measures that are contained within those objectives. You had to have previously participated in the program prior to 2017. So 2016 was the last year you had to actually join the program. If you didn't at least claim the AIU Adopt, Implement, and Upgrade, that the very first incentive that's available under the Medicaid program. If you didn't at least do that by 2016, you didn't have an opportunity to join after that. But if you did claim at least the very first incentive by 2016, then clinicians were able to continue in the program right up to this year, and to ensure that they can capture all 6 of the incentive payments that are available under the program. If you're not sure if you are still eligible, or if you're working with a bunch of clinicians and you've kind of lost track of where they're at in the program, if they still have remaining incentives to capture, you can click that link at the bottom of your screen there to verify your clinician's program status. That's going to take you over to the state of Michigan's michiganhealthit.org webpage, where they post a new PDF every month that lists actually all of the clinicians in Michigan that have ever participated in this program. So you can find your clinicians, and if it says, if you find them listed on that spreadsheet and their status is anything other than program complete, that means they still have available incentives to be had. And you've got this final few months to ensure that you capture all those remaining incentives. As Liz already mentioned as well, you can find these slides in the handout section of your GoToWebinar interface. I've got several hyperlinks built into these slides that will help you navigate the state system and whatnot. So this slide just sort of shows you the full range of incentives that we've had all the way from 2011 till 2021. We're of course in that final year. The program concludes as of December 31st, 2021. That puts you on a very tight timeline to attest to meaningful use this year, and I'll reiterate that about 1,000 times over the next couple of slides. Here also just note that you didn't have to actually claim each incentive consecutively year after year. This graphic would seem to indicate that, but that is not actually true. You could have actually just entered and got that first payment way back in 2011 and then have done nothing up to this point, and can kind of jump back into the program. The program has just been on pause waiting for you if you're one of those clinicians, and you'd still have that opportunity to capture at least one of the 5 $8,500 payments in this final year. We do see that from time to time, especially with the Medicaid eligibility requirement built into this program. Sometimes clinicians are sort of right on that border of 30% Medicaid volume, and one year they might be at 28%, another year they might be at 32%. So, excuse me, if you're not at that 30%, you couldn't attest to meaningful use for that particular year. You didn't actually lose those incentives. So you could pause for 1 year and then jump back in and pick up where you left off if you meet those eligibility requirements again. And as long as you're able to capture all 6 payments over that 11-year period by 2021, then you didn't miss out on anything. This was new last year and remains a requirement for this year as well. The state of Michigan kind of upped the ante with the data that you have to provide them to prove your 30% Medicaid eligibility is met. In prior years, you only had to provide an Excel spreadsheet that detailed all of your Medicaid patient encounters. The other side of that, the denominator in that calculation was sort of somewhat on the honor system. The state has had lots of issues when they're auditing folks years later, where they've been unable to reproduce that report that gave them that denominator count. It's caused a lot of audit issues. It's caused a lot of clinicians to miss out on incentives that have had to be recouped as a function of that. So last year, the state of Michigan upped the ante and has required folks to not only upload their Medicaid encounters, but you also now have to upload a tab on that same spreadsheet that shows all the non-Medicaid encounters so that they can validate that. It's really to protect you down the road in case of an audit. So what this slide's kind of details, you can get to the EP state level registration guide at that link at the top of your screen. Page 11 of that guide will give you some screenshots of some examples for the spreadsheets, so you can see exactly what the state of Michigan is looking for you to upload. So here's just a high-level overview. Of course, we've got the Medicaid PI program. There's 2 components to that, the promoting interoperability objectives and then the clinical quality measures. Again, this is just a review. There is a slight change, however, this year when it comes to the clinical quality measures. In prior years, we have had to upload a full calendar year of CQM data. That has meant that folks couldn't really attest to meaningful use during the calendar year. We'd have to wait until January rolls around and then make those attestations because we had to wait until that calendar year closed to generate that full calendar year of CQM data. That's changed for this year because you have a much earlier attestation deadline, which is September 30th. So at the end of next month. That, of course, means we had to make a change in the program this year for those clinical quality measures. So for this year and this year only, in this final year, it is a 90 consecutive days of data for both the PI objectives and measures, as well as your clinical quality measures. So here I kind of list out all of the different stage 3 objectives that we have been working with. There are no changes at all to all of these measures except one. And that is the objective 1, your SRA, the electronic protected health information. We had a slight change on that measure, just relative to when you have to have it conducted compared to your attestation date. In prior years, you have had to have your SRA completed by the time you attest to meaningful use. Because of that earlier deadline for attestation being September 30th, that's one slight change that was made to the program. You actually don't have to have your SRA completed prior to attestation this year, but it does have to be completed by December 31st. So it still has to be done within the calendar year. But previously, if you went to go attest and you attested no to that question, the yes or no question, did you complete your SRA? In prior years, if you attested no, it would kick you out and you were not a meaningful user. The system has been updated this year to allow a no answer, but with the caveat that you're saying no, I haven't completed it yet, but we will have it completed before the end of the calendar year. Aside from that, we didn't see any changes across any of the measures for this final year. Here, again, I'm not going to take a deep dive into any of the specific objectives and measures. I'm happy to answer any questions you may have on any of them, though, if you want to post them into the questions box of your GoToWebinar interface. Here, I am listing out all of the measures that have performance thresholds. So it's excluding the ones that are just yes, no, like the SRA. But all of these actually have performance thresholds. Again, we didn't see any changes, nor did we expect to see any changes to these thresholds, but just be aware that you are still working across these different performance thresholds. And note that when it says, let's say on the ePrescribe measure, that the performance threshold is greater than 60%, just note that we still see some EHRs. We don't see this too often anymore, but sometimes with those dashboards, they're programmed incorrectly, where it gives you your little green checkbox when you're right at the performance threshold. Let's say like right at 60%. The goal is actually, or the requirement is that you're greater than 60%, or greater than 80%, or greater than 35%. So every one of these, if you're right at 60% or 80 or 35, you're actually failing the measure still. You have to be any fraction of a percent above that. So it could be 60.00001. You'd be passing the measure. But if you're right at 60%, you're not passing that measure. And if you go to key in those numerators and denominators, and it comes in at just flat 60%, the system is actually going to show that you're failing that measure, regardless of what your dashboard shows. So just make sure that your EHR is giving you those green marks only when you are above that performance threshold. We still get this question from time to time. Of course, with the pandemic, a lot of you are still conducting telemedicine encounters instead of having those patients come into the office. Certainly understandable. And maybe clinics have been, or maybe are reverting back to doing the telemedicine visit. So the question is, do telemedicine encounters count? And the blanket answer is yes. In this program, telemedicine patient encounters are treated exactly the same as in-person encounters. This meaningful use program does not care if it's telemedicine or in-person. So during that telemedicine encounter, you want to make sure that you're using all the same workflows that you would do to meet the measures if that patient was right there in the office. So you still have to make sure that you or your staff are offering that patient portal to every single patient, even those telemedicine visits. You're going to ensure that you're pushing that electronic patient education material to the portal. You're going to be reconciling that clinical information just as you would be if that patient was there in your office in front of you, using that secure messaging functionality with those telemedicine patients, making sure that you're flagging and doing the workflows for those incoming as well as outgoing electronic summaries of care, so that you're taking care of those two HIE measures, which remain some of the most difficult ones to get through. So don't miss out because you're just failing to follow those same workflows for those telemedicine visits, really all of the measures. And that includes the eligibility calculations, both Medicaid and non-Medicaid. You can, those telemedicine encounters count for eligibility as well. So the clinical quality measures, I touched very briefly on this in terms of the little bit shortened requirement for data. We've gone from a full year down to a 90 continuous day reporting period for the CQMs. We didn't see any other changes across those requirements. So this is just sort of a review. You're choosing a minimum of 6 measures to report electronically. One of the 6 has to be an outcome or high priority measure. You are required to at least attempt to submit them electronically using the quality data file that your certified technology can generate. It's called a QRDA3 file. The next slide is going to show you some of the guidance around the submission of that. And there are 47 possible electronic clinical quality measures that could be built into your EHR. Very few of them offer all 47. Your EHR might only offer 6 because that was all that they had to build in to get that certification. If that's the case, there isn't much of a choice. You're just going to generate the data for the 6 that are available to you and upload that, and you're good to go. So as I mentioned, you have to at least attempt to do this electronically. We've had this system built for the last few years, so we're still using it in this final year as well. The state's system that they use to accept the electronic submission of your quality measures is called SCIMR, or the Clinical Quality Measure Reporting and Repository Service. It's a function of MyHIN, if you are familiar with that, MyHIN being the overarching HIE entity here in our state that works very closely with the state of Michigan. And really all that's happening here is that SCIMR system is taking your data in that file and validating it, make sure the file format is correct and everything looks all kosher with that file. And then it's just passing that data on to the CHAMP system. So you want to do that prior to attestation before you go into CHAMPS and start to attest to that meaningful use. You want to do this upload first so that when you get to that point in the CHAMP system where it's looking for your CQMs, it'll be sitting there in the data warehouse for you, and you can attach it to that attestation. So you're going to upload your QRDA3 file. It can be either an individual or group file. That's a nice little change that the state made a few years ago. Of course, you're not entering group data for your meaningful use measures, but you can upload a single group QRDA3, and that's going to then cover that submission requirement for all of your clinicians. So you're still going to go in and attest each one of them separately to meeting the meaningful use measures, but that same group QRDA3 file can be uploaded, and then it's going to satisfy that requirement across all of your people instead of having to do an individual one for each clinician. The link to where you register and submit those files is on your screen there. The state does want you to at least attempt to get this uploaded electronically, but there are a whole host of reasons why that might not be possible, and the state will give you a pass as long as you've kind of reached out to them and explained why you're not able to upload that QRDA3 file. You do that to request that enable web, or what we call break the glass request. You just send an email to that link on that email address on your screen right there. You're going to explain why you're requesting manual CQM data entry. You need to supply your certified EHR technology ID or your CERT ID number. There's a link to the Chapel site if you're not sure what that CERT ID is for your technology, and then give them any information about any troubleshooting that's taken place up to this point, if that's even applicable. There's a couple of reasons why there isn't any troubleshooting even necessary. One of which being that your EHR is charging you for that CQM data file. Some of you are already paying for that access to get that file, like if you're participating in the MIPS program, let's say. But if you are not participating in that, and the only reason you need this data file is to meet meaningful use, and if you are on one of the many EHRs that charges for that, you don't have to pay for that file. The state of Michigan doesn't want to see you incur any additional expense to meet this requirement to submit electronically. So if you do not want to pay for that file, that reason alone is enough to request that manual data entry, and the state of Michigan will accept that reason. Also, some EHRs can only generate a calendar year for that ECQM file. And if you are on one of those systems, one of those EHRs that cannot generate anything but a data file that contains that full calendar year, that is also going to be a reason to request that manual CQM entry before your reporting deadline, because obviously if that deadline is September 30th, you are not going to be able to generate that file in time to get that in. So if you're, again, those two reasons alone are enough to request that manual CQM data entry. There's a lot of other reasons as well. Although the EHRs are getting better with programming those files, we do still see some issues where the file format is wrong. And if you can't get your EHR to fix what's wrong, that also would be a reason to request that manual data entry. So looking at the program year 2021 timeline, we're very accelerated because of that attestation deadline of September 30th. So I cannot stress this enough. You need to pay very close attention to that deadline and the subsequent 3 months after that. So if you are ready to roll and you want to get your attestations done for the year, I highly suggest you do it now. Do it today. Get it done. The submission window actually opened on April 2nd, and the state started to see some 2021 attestations almost immediately. They've had hundreds, if not thousands, of them already get in over these last several months. We are well into your last 90-day reporting period. So if you didn't already have your eye on the ball, you are way behind the 8 ball right now. July 3rd marked the start of the final 90-day period possible to hit meaningful use this year. You would probably have needed to start that a little bit before that, though, because July 3rd to September 30th, that is the final 90 days, but you'd be hard pressed to get those attestations in time after close of business on September 30th. So you're working now to get those attestations in. You have to have them done by September 30th, as I've said a few different times. The reason for that is the state that needs at least 3 months. They need those next 3 months to process everything. There's a lot of validation of the data that happens after you submit that. There's the payment process. Everything that happens from the moment you hit submit takes a great deal of time. And the state of Michigan is not allowed to issue any incentive payments after December 31st of this year. That's written right into the legislation. So they need 3 months to make sure that they can process all of those attestations and get those payments out the door, because come January 1st, they're not allowed to cut any more checks. So they are going to be working very hard to make sure that they get all of those incentive payments out, as long as you get your attestation in by September 30th. The state has also provided some leeway in prior years for late attesters. There will be no late attesters this year. Whoever has their attestations done by September 30th is all they're going to accept. They cannot and will not accept any late attestations this year. So make sure you get your stuff in on time. One final slide before I get to any questions you might have. Vital considerations. I've already mentioned it several times. You've got to have those submitted by September 30th. Report as soon as possible. I cannot stress that enough. Get your attestation in, get it done, get it over with. Get your payment in hand, because you don't want to be a missed payment. As I mentioned, the state of Michigan, they're going to be doing everything they can to get those payments out before that deadline of December 31st. But you want to be on the front end of that. There's going to be a flood of work that they're going to be working on to get all of those out. So get it in now so that you can get that incentive payment wrapped up and out the door. As I mentioned, your SRA can be completed after your attestation this year, but it must be completed by December 31st. And you also want to make sure that if you are one of the folks working with MCEDA to have us conduct your SRA for you, that also must be done by September 30th of 2021. The reason for that is our current contract with the state of Michigan, where they are paying us to be out there helping you. That also ends on September 30th. So MCEDA will not be here unless there is a contract extension. The MCEDA is not going to be here after September 30th. So you have to get not only your SRA done, but that results meeting done. Okay? So we won't be able to conduct it after come October. Monitor the reports early and often for compliance with those program objectives. Again, can't stress that enough. Make sure if you have not already been paying attention to your metrics, to the meaningful use measures, you want to jump on that now and make sure that you're prioritizing and addressing any discrepancies, any workflow changes. Again, we've got, less than 2 months left to kind of button everything up, cross those T's, dot those I's. If you're not ready to attest yet, I would highly suggest working on your Medicaid patient volume, getting that wrapped up, getting those reports generated. That is work that you can do now, even if you're not ready, if you're not meeting those meaningful use objectives and measures. Go ahead and take care of that, getting your Medicaid patient volume reports all wrapped up, and so that's not going to slow you down when you are ready to finally attest, because you've hit those meaningful use measures. Also, I strongly encourage you all to verify that your contact and payee information, especially the email address for correspondence, is correct in the federal PI program registration system. A lot of you haven't gone back to that system since you first registered, and it could have been years ago when you went into that system. It's when you threw your hat in the ring and you opted into that program. There is an email address in that federal system. That is the data that flows to the state's system. And when you do an attestation, if there is a problem, if they have a question, they need to reject things, their eligibility is wrong, something along those lines, they're going to reach out to whatever email address is listed in that federal system. Those email addresses can be very outdated. We run into this every single year, where the state of Michigan is responding to an attester through that email address, and it's an old email address. It's one that's no longer monitored. It's from a previous practice manager. It's from a doctor who left. It's from whatever, for whatever reason, that didn't get updated. And so they're emailing somebody who no longer exists, and you don't want to be one of those, because again, we've got that really tight window, excuse me, to get everything buttoned up and get those payments out the door. So you need to make sure that that is an email address that is being monitored, so that if the state has to reach out to you following that attestation, they're not just shouting into a black hole. Because if that happens, you might miss out on that payment, because the state's not going to be able to process your attestation because you were not responding, because you didn't know you were supposed to be responding. So get into that system, update that email address so that nothing is delayed this year. And then you want to make sure that you're responding promptly to those communications. Again, just because you get that attestation in on time doesn't mean you're going to get your payment. A lot of attestations require rework, where the state has to push things back, or you have to correct things because there's issues. So respond promptly to any state communications. So again, to make sure that you get that last incentive payment. And as I also mentioned, although we are working on a potential contract extension, it's not in place yet. So as of right now, MCEDA stops being to be able to support you as of the end of September. Hopefully that's going to continue into the latter part of this year, so that we can help you with some of that rework. But as of right now, make sure that you are in close contact with your MCEDA rep over these last couple of months. With that, I don't see any questions that came in, and we are right at time. So if you have any questions for me, I'd be happy to answer them. I can do it now in our last remaining seconds, or you can reach out to me through the email address and the phone number on your screen. Seeing nothing come in, we will go ahead and wrap up for the day. Thank you so much for joining me today. We've got one more Meaningful Use webinar early next month. It's hard to believe that'll be my last webinar. I feel like I've done thousands of these over the years. So tune in next month. I'll repeat this information one last time. And if there's anything we can do for you in these final months to make sure that you get that incentive, don't hesitate to reach out. We love helping you, and we really want to make sure that you get those incentives. Thank you so much, and have a great day.